get into another important conversation as the world gears for Valentine's Day tomorrow. This is where lovers will be expressing affection for one another. The Gauteng Health Department, on the other hand, is cautioning against what it says is risky sexual behavior. The department has sounded the alarm over what it says is a sharp rise in sexually transmitted infections, including HIV infections across the country. Let's talk about this now, and we're joined by Maeshela Mahega, and she is from the Gauteng Health Department. Good evening to you, ma'am, and thank you for your time. When you say that there is risky sexual behavior, what are you seeing exactly?
When we talk about risky sexual behavior, we're talking about issues like when people will be engaging in unprotected sex, as in when they'll be having sexual encounters without using a condom. Another risky sexual behavior is when one is having multiple sexual partners whom they are also not protecting themselves, as in using condoms, either male or female condoms. Those are very risky sexual behaviors. Or anal sex without protection, oral sex without protection. Those are also risky behaviors, sexual behaviors.
When you say there's a spike, what are the numbers showing?
The numbers are like, for an example, we are now at, for females, the percentage, let me just give you the overall percentage. As compared to last year, we are now at 15% of the MUS, the male urethritis syndrome.
And when it comes to women?
Women, usually we test them at antenatal. So the spike is also high because what we are reporting on our district health information system, we are reporting the syphilis of the antenatal women, because with other sexual behaviors like burning urine, we usually don't record that, because basically they don't make us to check, they don't determine the sexual behaviors, because even when people maybe they are using rush soaps or foam baths, they will have burning urine. So what we want to check is issues around sexual behavior, and we're checking on the syphilis and the MUS, the male urethritis syndrome.
Yeah. When you warn that this risky sexual behavior is likely to rise if people don't behave themselves or use protection if they are going to have intercourse, what age groups are you looking at here where the risk of or the risky sexual behavior is manifesting itself?
The risk behavior is manifesting from the age of 15 years to 35 years. That's where the risk is very high, and the numbers are very high in those age ranges.
Sure. That's a worrying situation. And what advice, therefore, are you giving as the Department of Health? And would you say that preaching abstinence is still the way to go, or should that campaign now morph into basically educating these young people? Because if you're saying the age groups that are now at the center of this is between 15 and 35, it means that perhaps more sexual education needs to be the focus. Am I right?
Yes, you are right. So there is a need for an intense sexual education, which is happening because now we are using the modality, the TISH modality. The TISH modality is when we take the comprehensive package of the healthcare activities to the township, to the informal settlements, and to the hostels, and then to the tertiary institutions. So it's important, the take-home message is that it is very vital that our youth need to use the condom, both male and female condoms, because that's the only commodity that we trust to say it can prevent either HIV or pregnancy. Because remember, we're having PrEP that are being used to prevent HIV, but now it's important that we adhere to the dual one, using condoms, both male and female. If they can learn how to use it, because now we have plenty of them in our facilities and they are free of charge. We're also having our support partners. They're also assisting us to issue those condoms. We're also having our community health workers, our peer educators, and our robots. They're also facilitating to ensure that condoms are issued in the community, in the household, because they're doing that on day-to-day basis as they are visiting the communities or the homes. Yeah. They are doing visits on daily basis.
Final question to you.
The key.
Yes. Final question to you. I was just watching the space, social media, that is, particularly on the back of the statement that you issued. And people seem quite aggrieved about the behavior of either health practitioners, where people come forward to say, I'd like to have a condom, because then uncomfortable questions come, or it could be a person at the garage over the counter. You're trying to buy a condom and there are looks to certain comments. What would you advise there?
Okay, my advice will be that condoms, we need to take condoms like when someone is buying a toothpaste or a toothbrush. So now, what we are doing now, we are also focusing our education not only to the youth. We are focusing our education to each and everyone, like parents, like elderly nurse practitioners, because now the culture then and now is different. So now the elderly health practitioners are also being sensitized to say that clients might not be made for them not to be eager to come and visit the health facilities. Hence, we are having the youth-friendly services, because now we have realized that most our age group ranges between the 15 and 35. Now we are having our youth-friendly services, wherein the youth will be taken care of by their peers, their youth, to avoid things like being stigmatized.
So instead of passing judgment, you are advising that rather educate. Is that the message?
Educate. That's the message. We must play very far away from stigmatizing, because if someone is looking for a condom, in fact, when someone at the garage want to buy a condom, we need to clap hands to say, well done, instead of looking at him or her otherwise.
Thank you very much for that advice. Maeshela Mahega is from the Gauteng Department of Health, and it is a worrying development that there are STIs. They are seeing an increase there in those kinds of infections, including HIV. And the age group here, it's very, very worrying indeed. 15 to 35, that's the age group that is experiencing this spike in these types of infections.